最新乳房重建技術包括立體打印技術，可精準還原乳房形態，或利用病人嘅人體脂肪培養人工乳房，減低排斥風險，提升自然外觀同埋手術效果。蘇瑞珍報導。
對於唔少乳癌病人，要切除胸部係一個好大嘅心理關口，可能會感覺自我形象受損，因為唔少女性都會將胸部視作重要嘅女性象徵，係自信嘅來源。但好在科技進步，越見先進嘅乳房重建手術可以幫助病人重塑身材，恢復自信。Dr. Ron Warman 係一名整形醫生，佢為唔少乳癌康復者做過乳房重建手術。佢話加拿大約有10%至15%嘅乳癌康復者會選擇做重建手術，相比美國有一半乳癌康復者會做重建手術嘅數字低唔少。
Still relatively low. And there's a lot of reasons for that. You know, some women just don't want to go through another surgery. They've had enough. They've had surgery. They've had their treatment. They might not know that they have the ability to get reconstruction. So there's kind of that information we need to get out there to patients. There can be some risks associated with the surgery. Typically, I like the patient to be in generally good health otherwise, like not with a lot of heart disease or lung disease or diabetes, because that can affect the surgical healing. We certainly ask patients to quit smoking if they're smokers, because that can affect the healing of the tissue as well. And we like the patient to have a relatively normal BMI, in other words, not to be too heavy to undergo this surgery, because again, that can affect the wound healing.
進行乳房重建手術嘅時機一般分兩種，第一種係立即性乳房重建手術，指重建手術同乳房切除手術同時進行。外科醫生負責切除受癌細胞影響嘅乳房，而整形醫生就負責乳房嘅重建。呢種手術嘅好處在於手術次數較少，切除同重建手術嘅傷口可以同步恢復同埋愈合，無需額外嘅恢復期。另一種就係有啲病人會選擇於手術後幾年先至做乳房重建，即係延遲性乳房重建手術。病人可以有多啲時間去考慮做唔做手術，或者點樣做。醫生話無論係即時做定遲啲做，兩者並冇話邊種好啲，只係病人同醫生討論過之後嘅個人選擇。重建乳房普遍有兩種方式，第一種係使用自身組織去重建乳房，指移植身體其他部分嘅組織去重建胸部。大部分時間會因應病人身體狀態而使用腹部、背部、臀部或者係大腿嘅組織。而另一種方式就係使用植入物，呢種方式係將植入物放置喺胸部肌肉嘅上下方，去塑造乳房。
These are they're a silicone implant. It's called a gummy bear feel to it. It's a natural breast feel. The mastectomy surgeries, I can put what's called a tissue expander in. Now this is a little different because this goes in flat, like there's no volume in the expander. And then gradually what we do is the patient will come back to my clinic and we stretch the skin by putting a little bit of saline into the expander. So we do that about every week or two. And as this tissue, as the expander expands, the skin will expand. So this is useful in women who don't have enough skin or enough tissue to put the implant in right away. So this is a two-stage procedure where the skin is stretched a bit, then we'll replace it, which takes a second surgery, with the implant.
醫生話重建手術唔係新事物，而醫療界不斷研究新技術，喺植入物同手術技術上花功夫，希望幫病人做到越嚟越自然嘅胸部。
There's a lot of research from the implant companies that goes into not only like the outer shell of the implant, the shaping of the implant, but it's actually the makeup of the silicone gel even on the inside. So they've They've done a lot of research. So if you compare these implants to the ones that were used 30, 40 years ago, these ones have a lot less complication in terms of scar formation and durability and things that go along with that. We also are able to use something now called alloderm. It comes like a thin sheet, and it's stitched right into the muscle, okay, and right onto the chest wall, and that helps to hold the implant in place. Before alloderm, it was a little bit harder to shape the implant. Sometimes the implant would sit a little bit too low or a little bit too high, too much out to the side. But now with the alloderm that we use, it helps to create like a little, it's almost like an internal bra that helps to create and to hold the implant in place.
另一方面，依家立體打印技術發展一日千里，有醫療科技公司將立體打印技術應用於重建乳房手術中，當中有唔同嘅做法，但大前提都要係喺乳癌病人尚未做手術前，先為乳房進行立體掃描，記錄原生乳房嘅形狀同大小，咁之後如何使用呢啲資料就有分別。有啲醫療團隊以還原患者原本嘅胸部為目的，參考立體打印技術掃描出嚟嘅精準乳房立體模型，用植入物作為原料，打造出較似病人先天嘅乳房形態，重建病人嘅自信。另一方面，德國有醫療科技公司會抽取病人身上嘅脂肪去立體打印乳房出嚟，做法係用患者本身嘅體脂肪所培養出嚟嘅組織，製成人工乳房，會少啲有因身體排斥而出現併發症嘅機會。醫生提醒乳癌患者以及康復者是否去做乳房重建手術，係每個人自己嘅選擇。如果有任何嘅問題，可以徵詢醫生嘅意見，了解重建嘅各種選擇同利弊，再給予自己充分嘅時間考慮去作決定，咁係一個比較好嘅做法。
今日嘅節目時間就到呢一度，下星期再見。